I thought it would let me.
It's
Well, thank you all so much for being here today. We're excited to put this virtual chat on for you during Mental Health Awareness Month. You know, we take the opportunity during Mental Health Awareness Month to share information with our community and just make sure that people know about the resources that are available out there, whether it's through Peace River Center or beyond. But as you may or may not know, Peace River Center is the nonprofit behavioral health organization providing services in Polk, Highlands, and Hardee counties. A majority of the individuals we serve do come from Polk County and somewhat specific to the Lakeland area. But of course, we reach out to all in all three counties. We provide services in many different ways. So we have outpatient therapy, we have crisis stabilization, which means inpatient, kind of through the Baker Act. People in immediate need of emergency psychiatric services can access that through our crisis stabilization units. And we also have recovery services. So anyone who is living with a serious mental illness has resources through Peace River Center, with whether it's housing, day programs, case management, all of those things. And we provide all of our services through either outpatient, inpatient, in-home, at the school, in just any way that we can. Kirk will talk a little bit more about our crisis services when he does his introduction, and Donna about specialty services, and Morgan and Cassie as well in their line of work. So I'm going to kind of go ahead and let them take time to introduce themselves and talk a little bit more about that. And again, this is kind of a open conversation. So anytime you have a question, you can use the chat box at the bottom. You can directly send it to Donna there if you want to kind of keep those questions anonymous. And then we'll kind of have some moderated questions throughout this as well. So I'm going to go ahead and start with Kirk. So Kirk, if you'll just do a quick introduction and tell us a little bit more about what you do.
Sure. Good morning, everybody. Thank you for joining us. My name is Kirk Fasshauer. I'm the Director of Crisis Response Services here at Peace River Center. I've been with Peace River Center for over 20 years. I've been in the field of mental health for over 30 years, with psychiatric emergency being my primary focus area. So I do a lot of crisis work. The programs that I'm overseeing here at Peace River Center is the crisis response team, where we operate a 24-hour crisis line, and we have walk-in services as well as mobile outreach. And that's the big part of what crisis services does, is going out into the community. So the crisis does not necessarily need to come to us, but we go to it wherever that may be. And we've been to people's homes. We've been into the schools when schools were open. We've been other doctor offices. We've been to the local Winn-Dixie parking lot. Wherever we're needed, we will go. And because of that mobile response, we've done a lot of work with law enforcement in our community. And we have some really good partnerships with law enforcement. So if they encounter somebody who may be experiencing some extreme emotional distress, they can often call us out to help de-escalate the situation, and therefore hopefully avoiding some inpatient stay that are unnecessary. But if an inpatient stay is warranted, we can help that process along and bolster up whatever assessment is necessary for that kind of situation.
Eliana, you're muted.
Sorry, there you go. Donna, you can go ahead and introduce yourself as well and talk about your services.
Hi, I'm Donna Rininger. I've been with Peace River Center since 1990, so almost 30 years this year in December, and worked in several different types of programs throughout Peace River Center over my career here. Currently, I'm the Director of Specialty Services, which is specialized intensive types of programs. I work with the substance use services, the Family Intensive Treatment Program, which is a program for individuals with substance use disorders that are involved with the child welfare system. I also work with the Florida Assertive Community Treatment Program, which is a program that works with adults with severe and persistent mental illness, as well as the Children's Community Action Team, which is a program for children with severe emotional disturbances.
Great, thank you, Donna. Cassie, would you like to introduce yourself and talk a little bit about your program?
Yeah. Hi, my name's Cassie. I am in outpatient therapy. So we have locations in 3 different counties, right? The Polk, the Highlands, and Hardy County. And so what we do is we have a team of therapists that anybody can really come in, walk in when they want to get started and engaged in services. We offer walk-in hours as well as, the individual sessions and family sessions. So we have a team of therapists that are really skilled evidence-based therapists where we use a variety of different treatments from EMDR, cognitive behavioral therapy, DBT, maybe some sand tray therapy, where we create unique treatment plans that meet the individual needs of whether it's children, adults, families, couples, and then we really do a lot of work getting them connected to positive resources in the community.
Awesome, thank you. Morgan?
My name is Morgan Whitaker-Smith, and I work with the Community Action Team, the CAT team. The CAT team is a part of the spectrum of services that Peace River offers for children and adolescents and their families when they are experiencing mental health challenges and behavioral challenges. The CAT team works with kids who have been identified as being possibly at risk of residential placement out of home, and we provide multidisciplinary services, meaning they receive therapy, individual and family therapy, case management services, mentoring for the child and the parents or guardians, and medication management. And we go out to them in the community. So we go to the homes and schools under normal circumstances and provide as much support as possible to try to help the child and family be stabilized and be able to remain together in their home in the community and avoid having to go into residential placement unless it's absolutely necessary, and to help them achieve their life goals and increase their quality of life and be able to just function in ways that allow them to really reach their full potential. And we do that through, as Cassie said, a variety of evidence-based therapy approaches and many other ways that we support the families. We work on a lot of family bonding, helping families learn and cope with challenges in ways that are healthy and supportive of each other, and doing the best that we can to allow them all to really thrive.
Wonderful, thank you. I know that I've heard both Cassie and Morgan mention evidence-based practices, so I want to go ahead and jump into that. So if maybe Cassie, Morgan, Donna, maybe add in some more in-depth information about evidence-based practices and what that looks like. What does that mean?
Well, any treatment that has that designation as evidence-based, there has been a lot of studies that have been conducted and extensive research conducted, and it's been proven to be successful. So that's the main caveat, is that there has to have been evidence and research, several research studies conducted where it's shown its effectiveness.
And Morgan, what are some of the things that you use in the CAT team maybe to serve the children? What are some of the evidence-based practices? Can you dive into one of them maybe?
Mm-hmm. We use a number of different practices. We use dialectical behavioral therapy, DBT, which has shown a lot of evidence base for helping children and adolescents and adults learn to regulate their emotions more effectively and be able to function in relationships more effectively, so get their needs met in ways that are healthy and produce positive relationships. For many adolescents, that's something they're still learning, and so we help the family to learn we teach those skills to the child but also to the family in supporting them. We use cognitive behavioral therapy, we use EMDR, eye movement desensitization and reprocessing. We use brief strategic family therapy, which allows parents and guardians to interact more effectively with their children and help the family structure to be as healthy as it can possibly be, so that children can feel safe and supported, and parents can feel like they have healthy relationships with their children. We use lots of different methods of mentoring to provide support to the family. And we use a variety of we have multiple therapists who are trained in a variety of different evidence-based practices. We provide ongoing training to all of the therapists and mentors to help learn new things that are being researched and provide our families the best care and support possible.
Wonderful, thank you. Cassie, is there anything that you would add to that?
Yeah, the thing about mental health is it's not one size fits all. And so having a variety of different treatment interventions in our toolbox here as professionals, we can really reach a wide variety of people across multiple populations. And so we ensure that everything is tailored to the specific need. Like how Morgan was saying, if there's behavioral issues or relationship issues and you want to incorporate something like DBT, that may not fit somebody who went through a significant trauma experience and would need something more specialized and unique like EMDR.
Wonderful, thank you. So I'm going to dive into some of the questions that were submitted, and this is kind of going to go around to everyone as well. How do you believe people's anxiety is presenting during this extreme change in daily lives? So obviously, like during this pandemic, how are you seeing some of the anxiety presenting? And I'm going to go ahead and let Kirk answer that first, because I know he's over a crisis response team in our free crisis line. So I'm sure, like we talked yesterday, you've been tracking kind of what calls are coming in. So
Right. We've seen actually a shift in the nature of the calls that we've been getting through our general crisis line. What we're noticing is far less information referral kinds of calls, and getting more into the anxiety, the worry, and fear that individuals are experiencing as the isolation, the social distancing, the quarantine has taken place. So more and more of the calls have shifted into more of that crisis realm, that supportive counseling that we offer for individuals. So people are worried about everything, quite frankly. They're worried about losing their jobs. They're worried about family members who may be experiencing some physical illness. They're worried about their own physical health as well. So it covers really a broad spectrum of things. They're worried about becoming exposed and what's the right information to get, because throughout all of this, we've been barraged with lots and lots of information. Some of it good, some of it not so good. And people are at home, and what are they doing? They're watching a lot of television. They're watching the information come out 24/7. And that can be anxiety provoking in and of itself. So we've been encouraging people to, it's good to stay informed, pick out a few reliable resources to stay in touch with, so you know what the information you're getting is pretty accurate. And then take a break, step away from it for a while. Go outside, do something, walk around your yard. I've been sharing with folks some of the activities that families have done, getting reacquainted with their own backyard, as a matter of fact, holding little picnics in their backyard and playing in the yard again. That's a lot of things I've noticed even in my own neighborhood. Before the pandemic, we weren't seeing a lot of that. As a matter of fact, a lot of my neighbors have swimming pools that hardly ever get used, and I'm noticing those lanais and patios are being used far more often now. So it's kind of fun to see a different kind of shift in what's happening. But people are anxious about job loss, food supply, money, income, all the things that everybody else is worried about. And most of it's pretty normal reactions to this abnormal situation we're all in right now.
And to dive in just a little bit into that, I know you're saying they've been calling or doing but what are some of the things people might be doing that are out of the ordinary for them in everyday life that might be anxiety, and maybe somebody doesn't know that it is anxiety?
So what will start to happen is, especially when you've been in close quarters for a while, and again, these are people that we love and we cherish and promise to love and be with them till death do us part. And here we are now stuck in close quarters with them, and it's like, yeah. So what you start to see is small things starting to irritate your partner. And so there might be arguments blowing up over, you put the fork in the wrong place. It's like, this didn't normally bother you, and all of a sudden it is. So little irritable things like that, the feelings start to boil a little bit. And typically when you have that opportunity to step away, go to work, talk to somebody else, and you're in close contact with one another. Some folks who are from up north might be familiar with this term, cabin fever. During the winters up north, yeah, that we would see a lot of that bickering and things like that taking place. And unfortunately, if you've been following the trends in the news too, there are situations where people are concerned about increases in domestic violence as a result of that, and that I'm talking more extreme kinds of situations, and even the rise in possible child abuse as well. Because the children aren't out in school as much, they're not as visible as much, so the isolation kind of hides some of these behaviors as well. But on a more milder set, it's the irritability that people start to demonstrate, the bickering, the arguing back and forth that starts to show itself. You may even see some behaviors where folks aren't sleeping as well. That's often an indicator of excessive worry and anxiety. But then other things that start to happen as well is the increased consumption of alcohol and or other substances that folks tend to want to use during this time. I've heard stories where those in recovery are really having a struggle during this time because of the isolation, because they can't connect or get out and do other activities that help them in their recovery. And so they're sitting there lots of times with their own thoughts and cravings, and it's convenient. And so that happens. So there's a mixed package there. So if you start to see an increase in your drinking or other recreational activities with regard to substances, that also creates further anxiety and further problems in the household.
Can anybody else touch on that and how you're seeing maybe how some anxiety is presenting in others?
I can share what we're seeing with children and families, if that would be helpful. So one of the things that I've noticed a lot with families is that it's taking a lot more of our mental energy and emotional energy just to function on daily tasks. So it's a struggle to get out of bed in the morning, to go to bed on time at night, like Kirk was mentioning, lots of sleep disturbances, and we're seeing an increase in lots of kind of struggled emotional reactions between parents and kids, probably as a result of being together, but also because families have been thrust into situations that they weren't expecting, like virtual schooling has been very challenging for many people for a variety of reasons. Maybe they lack access. Maybe it's not something the parent feels prepared to do. The child may be reacting by taking out some of that stress at the parent because the parent is their safe place. And so then the parent is like, I'm trying to help. And this is, why are you lashing out at me? So I think that it's part of it is just that increase in everyone has more challenges that they are struggling to cope with right now, combined with our external markers that we use to kind of order our lives, like getting up and going to school or getting up and going to work or daily routines. Those kinds of things have shifted and changed for many families. And when you put those two aspects together, it has made it very hard for families to find a new rhythm of life. So we've really been encouraging families to I'm a big fan of a dry erase board or some other something in the house that can provide a general schedule, like everyone's going to be up and dressed by this time during the day, and we're going to be, doing this is time when we're together, this is time when we're apart, and then we're going to eat a meal together at this time, so that we're building some structure into lives that can decrease that sense of everything being out of control and chaotic, which is such a huge risk factor for anxiety when it feels like everything around you is shifting and there's no solid ground. If we create a little bit of that in our lives to the best extent possible, it doesn't have to be a rigid, it's 8:05 and we're going to do this, and 8:10 and we're going to do that. But if we can create a little bit of structure, that really helps with children lowering their anxiety when they have a predictable structure. They know what's going to come next. They understand what the rhythm of the family life is going to be. And as their anxiety level lowers and they feel safer, the household hopefully becomes a little less challenging in terms of behaviors and things like that, and everybody's stress level and anxiety decreases.
Very good. Cassie, is there anything you would add to that? I think you're muted. Great.
Sorry. All right. So building off of what Morgan says, an outpatient, we get to really see both the parent and the child. And so a lot of the increased anxiety that I've been seeing is really related to a lot of the school changes, not only for, these children who've had their lives completely switched and stopped with a lot of unknowns, which really feeds anxiety. And then we have parents who are dealing with their own stressors, their own mental health stuff, and now we're adding on an additional layer of worry with getting in schoolwork and completing tasks. So one thing that I think is really important is just to be mindful of a lot of the somatic changes that I think everyone touched on, whether it's a little harder to get out of bed, or we're tossing and turning at night, or going on this worry hamster wheel. And those are a lot of the really big warning signs and risk factors.
Donna, can you also touch on that? And then Kirk alluded to the struggles with substance use. Can you, once you do the anxiety thing, go into that?
Right.
And,
People who are early in their recovery, all people in general, when we are overly stressed, we tend to fall back on coping mechanisms that we've used in the past, whether they're healthy or not. And so when someone is in early recovery, this time right now that we're going through in our world is especially difficult for someone who's in early recovery, who may not have developed some good coping skills, life skills at this point, to be able to cope in just a regular situation, life situations, when you add on to what we're experiencing in our world right now with being, in a tight space and having to deal with relationships. They may not have dealt well in relationships in the past and use substances as a coping mechanism to help them or to relax them in their mind, to be able to try to relate with other people. And now when it's not, when they're trying to maintain their recovery in a situation like this, and you have the added stressors of the whole household dynamics changing due to the stay-at-home measures, a lot of individuals have lost their income during this time, and it's an additional stressor. And so they're having additional stressors added to them during a time that is very stressful anyway, when they're trying to learn new life skills that are more adaptable to a sober lifestyle. So what we're seeing is a lot of those individuals, we're getting crisis calls that we've been getting, and the crisis walk-ins that we've been getting in my office have been related to those issues with individuals who are early in recovery and not doing well. And it creates a big problem right now, because if they're at the level that they need residential care, with the pandemic going on and the safety measures that have to be taken, they can't bring on any additional admits into a facility. And so it's difficult to find them the care that they need. And we're having to increase our interactions with them. They come into the office 3 and 4 times during the week. We're seeing people sometimes as many as 4 or 5 times a week, and on the phone with them a lot to give them that extra support that they need during this time until we return to normal operations. So that has been a challenge, especially for people that are in that population.
Thank you. That is all really good information too for individuals who are struggling with their recovery, but also, let's see, is there, I'm going to move on to some of the questions, and I'm going to ask Cassie for some. This one's more directed to you, Cassie. So Cassie, if someone has been diagnosed with depression, can you give options other than medication? What kind of other things are out there for individuals who may not be as willing or interested in medication?
Yeah, absolutely. Depression varies from different root causes to severity. And so sometimes it's as simple as just getting people connected and increasing their support system so that they just don't feel so alone, or they can come in and we can help them learn and enhance coping skills and self-soothing strategies. Also, a big part of depression has to do with our thought patterns, and we have these default ways of thinking that are initially built to keep us safe, and they start to get a little bit twisted. And so we can really work with them to challenge and reframe these unhealthy, unproductive thought patterns to ones that are healthy and productive and more calming. We also use different kinds of behavioral activation strategies where we're incorporating some kind of positive behavior replacement, or even learning things like deep breathing or relaxation techniques, teaching skills that have to do with sleep hygiene, or even helping people just getting moving so that they're more active and connected, even with outside or moving in their chairs. It has a significant impact, and sometimes they just need a little bit of, direction or guidance and where to get started.
Very good, thank you. I'm gonna turn, yes.
We do have a question on the chat. I don't know if you noticed. Can you see it, or do you need me to read it?
Oh, yes, no, this is good. Okay, so Cassie, can you, back to the evidence-based practices, there is a parent-child interaction therapy, or can you tell us a little bit more about that and give the correct name, because I know I just butchered it.
Nope, that's right, the parent-child interaction therapy. It is a intervention service that we offer in outpatient. And so what's really neat about this is often when kids and families come into an outpatient setting, the children are on their best behavior, or their behavior isn't that what the parent is struggling with in the home. And so when they're in that environment, you really have to break down some walls, excuse me, in order for them to be more comfortable to work with them. So this particular intervention, we have a room where the parent and the child can go and interact and play. So where the little one can kind of let their guard down, and we can watch and observe the way that the parent and the child are interacting. Meanwhile, we have a therapist who's observing this from the outside room and watching the behaviors, and then prompting and guiding the parents to work with the little ones in ways that are more helpful for the child and the parent.
Very good. And that, like you said, that's an evidence-based practice. And I know a lot of the times as a parent, I like to call it as as your guidebook. You never get sent home with a guide to how to parent your child, but hey, when you're having issues and there's a break in that, then there's parent-child therapy for those extreme cases.
Mm-hmm.
Thank you. Kirk, this question's for you.
Okay.
What is the first thing you should do, anyone, if we feel like a loved one may be suicidal?
Okay. Well, one of the first things you want to do is ask. Don't be afraid to have that dialogue with the individual. Because if you're feeling that that is going off, I like to tease people and say, hey, if your spidey senses are going off, you want to say something to the loved one or the friend, and you'll get a couple of different responses. You may get a flat out, yes, I am thinking of taking my life. And then you know what you're dealing with and have that dialogue and reach out to support systems that are out there. And we'll get into that in a minute. The other two are a little more complicated. When you get somebody who flat out says no to you, it's like, no, what do you think? I'm crazy? I'm not thinking like that. Why would you have? Well, clearly you had some sense of what was going on there. So again, that's an opportunity to share with your friend, your loved one, what you were sensing, what you see was going on. It may have been some misinterpretation, but at least there are things you're picking up on that that person may not be picking up on. As to how they're behaving, how they're thinking, how they're talking about that situation. So it can start a dialogue. The third kind of answer is a little more complicated, where you ask the question and there's this pause. And then you get, no, oh, well, for me, that's a yes, because there's a pause there. There's some thought process taking place there that there may have been some contemplation. So one of the first things you want to do definitely is start that dialogue. When somebody is kind of contemplating taking their life, that's a difficult time. It's not a time to be judgmental. It's not a time to lecture on the rights and wrongs of taking one's life. Well, that's an opportunity for you to stop, to listen, and really listen to what that person's saying. Don't be afraid to ask the question. Most people are, because there's this huge myth around even having the discussion about suicide, that it places the idea in their head. Well, I'm telling you right now, the idea was already there, if it's there, and having the dialogue or starting that dialogue actually presents a sense of relief for the individual with that thought process, because their secret's out, if you will, or, oh, you what are you seeing? Or again, a dialogue is pretty important. Now, dialogue alone isn't going to fix everything. So you definitely don't want to keep it a secret between the two of you, for example. You want to get out there and get into other resources and let that person know, hey, I'm not going to go out there and shout from the rooftop, hey, this is what's going on with you, but I am going to get some additional help for you. And we've got resources out there that are very beneficial to help. For example, our crisis line, 519-3744. They're available 24/7 for anybody to call about any emotional issue, not just suicide, but it's out there. We also have here it is the National Suicide Prevention Lifeline, which is more national. That one is 1-800-273-8255. Again, 1-800-273-8255. And that's the suicide prevention hotline that's out there for the national one. Locally, we've got our crisis line at 519-3744. Usually, if somebody calls the national line, it does get referred back to the local resources to help intervene, to do some follow-up. So we really try to keep it local, and we know the resources here in town, and can usually send the counselor out right away to come and talk with you about what's going on and what's happening. So 519-3744. Don't be afraid to call us. I don't care. Share it with everybody. Write it on the bathroom wall for a good time call. You know, hey, somebody will answer the phone 24/7.
We will make sure to put, when we post this recording, we'll make sure that we add those numbers. And of course, on our Facebook page and peacerivercenter.org, we have all of that information. Thank you so much, Kirk.
You're welcome.
The next question is going to go to Morgan. Can you you talk a little bit about the coping activities that you are working with that maybe you see an improvement with kids and anxiety?
Sure. So as I mentioned before, anything we can do to build routine and structure into their lives. Sometimes kids will seem like they're resisting structure, but it's actually a huge part of their feeling safe and secure through uncertain times, and even in normal times, but especially when other things have been taken away. So building that routine and structure, I think, is very important. One of the things that I've really been encouraging families to do lately, and have been practicing in my own life, is to be engaged in something creative together as a family. Because if, anxiety is our body's natural response to being chased by a hungry bear. So our body's responding as though we're being chased by a hungry bear. And if you're being chased by a hungry bear, it's not the time to stop and paint something. So if you can do something, to try to bring out that creativity, it's also teaching your brain and your body that we're safe in this moment. There's a lot of scary stuff going on in the world. There's a lot of things we don't know the answer to. But in this moment, we're okay. We're right here together, and we're going to be all right. So I've been encouraging families to cook together, to go out and for some families, that's a stressful thing. So if it's stressful, if it's adding stress, don't do it. But sometimes cooking or baking something together can be helpful. I'm a big fan of backyard art. So going out and finding various little things out in the yard or on the patio, and making some kind of art mosaic and taking a picture of it, and maybe everybody lays down next to it and gets in the picture too. Maybe not. If you have younger children, Legos. I know parents, sometimes that's not the most thrilling thing to do, but it means a lot to the kid if you sit and play Legos with them. Teenagers, a lot of teenagers will get into camera selfie art. So taking fun, creative selfies together as a family can be really fun, or setting up really cool backgrounds. I love the virtual world tours that are going on, where people are recreating scenes from various places and the family gets together. So those kinds of things, they serve several purposes. One is they promote bonding, and they help communicate to the child that they're important, and that the parent is prioritizing taking time with them and meeting their needs. So that helps with calming for them, helps them stay safe, because especially for younger children, their family is very much their world. And so if everyone is happy and together in that moment, even if it's just for a moment, you might have been like stressed out in the morning and stressed out in the evening, but right now we're all together and we're doing something, that's going to help a lot. But also it's a chance for the child to feel competent and to contribute to the family. And when we feel competent and we contribute, that helps to lower our stress and our anxiety as well. It's something that maybe the child teaches the parent a cool way of making a Lego wall that moves. You can look it up online. There's a way to do it. Maybe the teenager is teaching their parent about filters on Instagram. So you can allow the child to be the expert in the moment, and that's going to help them feel calmer and competent and bring out the best in them. There's a lot of emotional regulation strategies that you can find, breathing strategies, things like that, to help prompt the child through. But one of the things that I have been encouraging parents to realize, that it's okay to let the kids know that you're struggling with this too, and to be honest about your feelings. You don't have to tell them every single thing that you're maybe scared about or whatever, but if they see you seeming stressed out, it's okay to say, I'm stressed too. This is really hard. We're going to get through it together. We're going to do the best we can. And I think sometimes parents get the message that I have to maintain this stiff upper lip and I can't let them see anything. But really, a lot of times for kids, it's very helpful to them to see that their parent is going through a similar emotion as well. And then to know that that's normal and it's okay if that's how they feel, and to be able to know that their parent is getting through it together, and we're all in this together.
Yeah, awesome. That's really good information too. Just being authentic with your children, being in the moment. Okay, let's see. I know we've got about 15 minutes left, so I do also want to leave time for any other questions out in the open. So let's see, Cassie, how does family history impact the likelihood of mental illness? Did we already cover this? I'm sorry if we did.
No, but it definitely can have a significant impact. So there is a genetic component that comes with family history. So that doesn't necessarily mean that if, mom, dad, grandma have depression, you're guaranteed to have it, but there are some increased vulnerabilities when it does run in the family. The other thing is it really helps paint the picture of what kind of environment the individual grew up in. So if you know that you have a parent that's using substances and the type of substance, it can really create a clear picture in whether or not, if they were using something like amphetamines, whether or not there was food in the home, whether or not there was a lot of absent parents. Also, if you have kids that grow up with one parent who's gone. And so even when they grow up to become an adult, it has some pretty significant impacts. We learn our core values and core beliefs from our families and the environment. And that really does have this big connection with self-love, connecting with others, and even how we learn about relationships. So family can be one of those things that can really build and help improve. There are other family members that are going through things by being that support and connection. And they can also be a source of a lot of the stress, like how they were saying in the beginning, when now we're all on top of each other in close quarters. So it can have a strong impact.
Good. I know that for some families, it's, learning how to, as you grow older, maybe you've gone through those traumas or those experiences, how as an adult you have to, cope with your parents and how to behave, or I guess, how do you manage your own feelings towards a parent? Because, as an adult, have a mom, you want to have a relationship, but that mom might be a source of anxiety for you or a source of some emotional distress. How do you deal with that? And how do you, I guess it's more individualized to each individual, but what does that say? Like, how do you, I guess, interact or learn some coping skills for that?
Well, and it does. It's very individually based and depends on the person that you're working with. So sometimes there's a lot of resentment and really learning skills related to things like forgiveness. Oftentimes people feel that if I forgive, then it means that I'm saying it's okay that it happened, versus coming to the point where I'm accepting the fact that I don't want this to have power over me anymore. And that acceptance isn't always pretty and beautiful and shiny and fun. Sometimes it's really that dirty, gritty truth. And so really helping and guiding them so that they can honor their own truth and their own experiences. There's a lot of times where there's self-blame and there's going back to those thought patterns that are very self-deprecating. And so really getting in there and helping them to challenge them, because if we think back to when we were kids and the way that we saw things, and, even if it's that one, adult you knew or that show you watched, and then you watch it again, and as an adult, you like, well, how did I miss that? How did I not see that? Why did I remember that so differently? And so part of it is just really working with the present perspective that they're dealing with, and even validating that what they're going through and how heavy that experience really was for them.
Very good. Good information. Morgan, what can you tell us a little bit more about children and mental illness? When is the typical onset? And I know it maybe looks different for each illness and maybe each child, but can you give us kind of the general overview of that?
It really does look very different depending on what the child is experiencing, and there are some challenges that you might see very young. Things like ADHD, sometimes those symptoms can start manifesting very young, in the toddler and preschool years even, although it's hard to tell at that age because it's hard to differentiate between other things that might be going on. Other things may more typically manifest in late adolescence or young adulthood, like oftentimes the onset of schizophrenia and bipolar disorder can be later. But even with those kinds of challenges, you can sometimes see the onset much earlier. So it really depends on a whole variety of factors, genetics, lots of things related to the family environment, the child's own personal history, lots and lots of different things. And I think the thread that runs through all of that is that just like Kirk said, the spidey senses, if your parents' spidey senses are telling you that something is not the way it should be, then there's nothing wrong with reaching out and asking for someone to help you understand what's going on with your child. It may be something that's happening, and I think sometimes parents are like, oh, I don't want them to have a label, I don't want them to, and that's a totally understandable reaction as a parent, to not want your child to have labels, or I don't want them to be forced onto meds or something like that. And I think it's important to remember as a parent that you still have so many options, and giving yourself reaching out for more information can only help you as a parent to understand what those options are and to feel less alone if your child does seem to be experiencing a challenge in some way. If there's something where you've tried, when children are behaving in a certain way and it seems like they're acting out, a lot of times, very often, they're seeking to meet a need that they have, that they don't have words to express. And the only language children have to express things oftentimes is their behavior. So if you're seeing a repeated behavior that seems very challenging and you're like, I don't know why this keeps happening, it may be that your child is communicating in the only way that they have, that they need support in some way. And as a parent, that doesn't mean that you are not enough for them or that there's something wrong. It means that that child may need something else, something more, something different, or they may just need support in some way. And parents don't have to feel so alone, because the children, there are lots of resources out there and support. And as a parent, you have lots of choices over how that child gets services or what might help with that. So if your spidey senses are up that something's going on with your child or a child you work with, reach out and get help and find out more information, and because it can only help you to have more information and more options on the table for it. So.
Sure. That's great information. I know that we've got a couple more minutes left, but I'm going to switch it up a little bit and see if there are any questions from anyone that's joining us before I move over to some additional questions that I have. Is there any questions? Does anybody have anything that they want to ask? Okay.
Yeah, I had something to this though, Ileana.
Sure, absolutely.
With all the discussion going on, we've said over and over, reach out if you have questions about what to do in these stressful situations. I want people to consider our crisis line is not just for someone who is feeling suicidal. A lot of times people are struggling with different issues, with maybe, what to do with their child during this time, a behavior that the child is engaging in, or people who are in early recovery and are struggling with urges to use. These, the crisis line can be utilized for that type of questions and answers also. It doesn't mean that you have to be suicidal to use the crisis line. I think sometimes people associate that word crisis as meaning something that could be fatal. And it's not. It's when you need more information on just how to cope and deal with situations, that's what our crisis line is for. So don't hesitate to call with questions. If you have any type of questions that deal with relationships or how to deal with certain situations, please reach out and give us a call, because we can help in those ways too.
And I'm going to pick up a little bit on that and add to that as well. What are some of the community education that's available? Donna, I know you're trained in several things, and you recently were trained in mental health first aid, and Kirk as well. So can you talk a little bit about that?
Yes, we have mental health first aid, like you just said. We have that community education that's going out. There's I'll be doing a session coming up soon on the eye movement desensitization reprocessing that we talked about earlier, the EMDR. If you're interested in learning more about that, we have information coming up regarding that. And a lot of the different evidence-based therapies that you've heard about today, there's education out there where we talk about the different evidence-based practices and just ways of dealing and coping with different situations. So we have some other community presentations coming up, and there's a lot out there available. There are a lot of agencies right now that are putting information on their websites. If you go to Peace River Center's websites, there is a ton of resource information that covers a large variety of different types of issues and therapies. And so utilize those resource pages on not only Peace River's websites, but various websites with Heartland for Children and different agencies. The Department of Children and Family has some wonderful resources on their web pages. So while you're at home and having to not be out and about, get online and look through some of those resources. There's some wonderful information that's out there.
Wonderful. Thank you. Kirk, did you want to add to that? And then I'm going to throw another question at you.
Okay. Yeah. So Donna talked about a lot of the good resources and presentations we offer. We also do things on stress management and anxiety. We've got a couple of presentations out there that happen on a regular basis. One of the things that I do to help with reaching out into the community is something called CIT. That's Crisis Intervention Team Training that's offered to law enforcement in particular. So a lot of law enforcement in our community have been trained to understand and work with individuals who may be struggling with some severe emotional issues, not just the mental illness aspect of it, but the broad range of any mental health issues somebody may be experiencing, as well as the mental health first aid for youth and adults. We offer those trainings as well. So if you ever want any of these trainings or want to know when these trainings are taking place, by all means, take a look at our website, which is peacerivercenter.org, and that information will be published out there for everyone to tap into.
And I know there's a lot of education that we do, and one of the things that I would love to educate more people on is how to remove the stigma surrounding mental health. And so a lot of the times individuals, when they hear the word Baker Act or you know, they were inpatient or whatever, they think such a negative connotation around that, right?
Absolutely.
So I think that maybe all of you can add to this, and I know we're running low on time, and we can just, you know, continue the conversation. And if some of you have to go, we totally understand that. And again, this recording will be available on our website. But can you talk a little bit about the Baker Act in short, Kirk, if we can, and how this doesn't necessarily have to have a negative connotation in our community and around the globe, really?
You're right. Absolutely. So for Florida, the Baker Act is the involuntary, or is the commitment law here in Florida. It's actually called the Florida Mental Health Act. We refer to it as the Baker Act because of the representative who championed the cause way back in the early 70s. And it's about patient rights and how to initiate the process that somebody who is in severe emotional distress, how those types of crises or those situations can be handled. There are a few groups that can initiate that Baker Act process, one being law enforcement. They have some training in that particular area. We've got the court system where families can go to the probate courts and request what's referred to as an ex parte. And that again is a process family members have to present before court, kind of an evidence, and they give testimony that gets approved by the judge, and then the loved one or that person can get picked up by law enforcement. and brought in. And then there are the licensed professionals out there. There's a whole list of licensed professionals who can initiate a Baker Act as well, based on their observations and their encounters with the individual. Now, like Ileana said, there's this huge negative connotation with the Baker Act, and it's not meant to be a punishment. This is actually the start of a lot of folks to get the help that they absolutely need. And because of some of the illnesses that are with mental illness, they often do not have the insight to the fact that they are very sick and how it's hurting them and those around them. And so, yeah, it's seen as, oh my God, this is the worst thing. Well, it's a very serious thing, and the Baker Act should never be taken lightly, because we're actually temporarily taking somebody's freedom away for this examination. And I want to stress that Americans, if anything, they love their freedom. So when we say we're taking your freedom away for a little bit, it's got to be pretty serious and pretty distressing for that individual. So that's why I like to stress that, because it should not be taken lightly. But it is a tool, it is a process that is meant to be helpful for those who are struggling with some serious issues. And so, yeah, those three groups can initiate, but you know what? You yourself can initiate if you feel like you need that help. You can come in into one of our walk-in clinics and talk to somebody, and that could be the dialogue. If you understand that you need some help and you're trying to reach out and you've tried everything else first, because this is a very restrictive kind of course of treatment. And if you feel like you've tried everything and you want to take this next step, you can also sign in to be examined by a psychiatrist and observed by people for a while, because you're unsure of your own safety and whatnot. So even with those with severe and persistent mental illnesses, like the illness of schizophrenia, folks who suffer and struggle with that illness can sometimes, get an understanding that, okay, I know my pattern and I think I need to stay out of society for a little while. They can come in and sign in. And actually that's kind of a tool towards recovery, if you will, that when they can start to recognize when they're struggling, they can come in and say, hey, I need a break right now, and do it on their own. So it's a gradation in taking care of yourself, if you will, so that it doesn't involve law enforcement, doesn't involve all these other resources. Because having law enforcement come out and do an assessment can be very embarrassing, can be a little, demeaning in the fact that, unfortunately, the way the law is set up, law enforcement is the group that provides the transportation. And for their safety, they're often going to put you in handcuffs. And now you're in the back of a patrol car being driven to a facility, and you've not committed a crime. It is not a crime to be Baker Acted. It's a civil process for healthcare needs. And so, unfortunately, all the other symbols that surround criminal activities are involved in this process. And that's primarily because of the resources and safety issues in some extreme cases that those are being used. But individuals, again, I want to stress, can come in and sign themselves in if they want to. Again, this is kind of the last stop on the train route to go because it's very severe. So
right, so it's kind of some people as a last resort, kind of the entrance into additional resources. So
correct.
If you
correct.
Maybe Cassie, talk about some of those additional resources, because everyone that touches our PRC services, our Peace River Center services, gets connected to resources. So Cassie, can you talk a little bit more about that too?
Yeah, so we all have those points in our life where we just need that extra support. And so a lot of times people in the community, they don't have it. We don't have that person that we can go to. And so when somebody comes in or somebody is reaching that point where they're very low and they need something additional and they don't have it at home, then they're reaching out to a community support. And so sometimes that community support may be the inpatient, just to kind of get them jump started. And then when they come in to see us in outpatient, you know, maybe they're looking for case management for their children, where, you know, their children may have a therapist, but they need additional services in the home and in the school. And we are a good resource to get them connected to that. Or if we have individuals that are maybe they're constantly going in and out of inpatient because they don't have the tools or the skills, we can get them connected with even our psychosocial rehab, where they can kind of learn about the type of mental illness that they're dealing with, because awareness is just one of the greatest tools. If you know that this is going to happen, and then as soon as that happens, these symptoms are going to follow, and you are aware of your warning signs, you can really start to combat it and prepare yourself. I often, when I talk to my clients, talk about, I don't want to send you into war without the right armor, without the right weaponry. And when I'm talking about that, I'm talking about them going in to deal with whether it's emotional regulation, whether it's a family issue, whatever it is, that they're going in with the right tools, the right skills, so that they can protect their vulnerabilities in a way that's going to be healthy and productive. Nobody wants to go to war empty-handed. And sometimes it's what it feels like when we're so hypervigilant and we're on edge because of all these things that are going on or things that have happened. And so one of our resources is really empowering the individual.
Very good. I love that analogy of the armor. And I know Donna had a great analogy about the coffee and spilling over onto your white shirt. So I think we need to start like a Facebook page for PRC analogies. I love it. So I'm going to throw out one last question so that we can wrap this up, but I want to send this one to Morgan. You touched a little bit about getting out there and moving. We know it's a pandemic. There hasn't been a lot of individuals being able to access those trails and stuff. How important is physical health to our mental health right now?
I would say it's very, very important. There are, we tend to think that we're like this brain floating around in a disconnected body, and those two things don't interact. But in reality, what we know is that our physical health and our mental health are deeply interconnected in a variety of different ways. And we are stuck at home right now, but there are also a lot of things that we can do right now. There's a huge variety of online resources, that many of which are free right now, that can provide ways to keep your body moving. I think this is not the time to like undertake some huge massive weight loss regimen or something like that that's going to be very difficult for us to do, but it is a time to really take good care of ourselves. So that means like hydration is very important. If at all possible, getting a little bit of exposure to some sunshine every day. Any kind of exercise that you can do, especially things that are calming for the body, like yoga, walking, if that's possible. I know many folks struggle with chronic pain or other ongoing health challenges, and there may be things that are not as accessible for everyone, but we can all do the best we can to control the things that we can control in our environment. Sleep is so critical, getting enough sleep, getting quality sleep, eating healthy foods and a variety of foods as much as possible. Experimenting with what works for you in terms of your schedule, and doing those things that you can do to keep your body healthy. It's like, if you imagine a glass of water, right now we have a lot of things that are pulling water out of the glass, lots of stressors, lots of things that are draining our emotional reserves. And whenever we take care of our bodies and do the things that we can do that are in our control, it's like pouring water back into our glass and filling our glass back up. And that's going to give us a deep well of emotional reserves to be able, when our kids are screaming and we need to be on another Zoom call, and teacher is calling us about something that needs to be done. That's a day in my life. But so when all of that's happening, that's pulling on our emotional resources, we want to be really intentional about doing those things for ourselves physically that can fill our emotional resources back up. And physical health is a big, huge aspect of that. So do what you can do, and be gentle with yourself through all of this, is what I would say.
Yes, be gentle. This is all not normal for all of us. So being gentle is good with yourself and others. So in that, I'd like to open it back up for any questions. If we have anyone who's been joining us via the phone or here through the video as well, please feel free to ask questions. You can use the chat box if you would like and direct that question directly to Donna if you'd like to stay anonymous, but we're here. And if there are no questions, any questions? I'd just like to take a moment and say thank you to everyone. Layla, did you want to ask a question? I'm sorry, I saw that you unmuted, so I don't want to keep talking if you had something to say.
Yeah, I just was going to say thank you, and very informative and helpful to us at the Children's Museum as we're opened and are working with families and children who are very stressed at this time. And we're working with e-learning, helping kids with their virtual assignments, and hoping to be that coping to help those parents to go through this piece, to know that they have our support. And I think that's huge. And as we move on to the summer, we are going to be open for healthcare workers and first responders and offer free.
That's a great resource.
Yeah.
Mhm.
And again, these parents, I've been on phone calls and conversations and Zooms, and they are very frustrated right now with even understanding how to use technology in the home. And I was speaking to one of the parents, and she was yelling at her child as I was talking to her, frustrated because of what the child had to do. And you know, just walking them through and knowing that we're able to help with this. So it's huge. So for sharing, I appreciate it.
Well, that's a great, yeah, thank you. That's a great resource in our community too. And thank you all for being open to provide childcare for the essential workers. I mean, essential workers have not stopped. So I appreciate that so much. Well, I want to thank again everybody for joining us. This has been a really fun experience. So if you have any other closing remarks, anyone that you kind of are thinking, sitting on, I should have said this, give it a whirl. You have 30 seconds. No one? Well, like I said, this information will be posted on our Facebook page, I think, right, Jessica, maybe, or on our website, on our resource page. So what we'll do is we'll email our attendees back out a quick survey and include this presentation and information that we shared here as well today. So thank you, Cassie, Morgan, Kirk, and Donna for joining us. It was definitely an informative session, and hopefully we can do it again. So thank you all so much.
Thank you.
Thank
Bye.
you.
Thank you.
Bye.